Your legs are trying to tell you something. And most people don't listen until it's too late. Not because they don't care, because the signs are quiet at first. Easy to explain away. A little stiffness in the morning. Feet that feel cold even when you're warm. That strange heaviness that settles in your calves after you've been sitting for a few hours. You chalk it up to age, to a long day, to bad shoes. But what if it isn't any of those things? Dr. Haruki Tanaka has spent 41 years watching what happens when people ignore what their legs are trying to say. He's a vascular specialist based in Kyoto, trained at Osaka University, then spent 2 decades studying circulatory medicine in both Japan and the United States. He doesn't look like what you'd expect. 73 years old. Quiet voice. The kind of doctor who pauses before he speaks, like he's choosing each word with care. He started making these videos because of a patient named Kenji. Kenji was 62, a retired school principal. He came to Dr. Shigeaki Hinohara not because something was dramatically wrong, but because his daughter made him. She'd noticed that her father was walking more slowly than he used to, that he'd stop on stairs and pretend to look at something, when really he was just catching his breath and waiting for the ache to pass. Kenji had dismissed it for almost 2 years. By the time he sat across from Dr. Tanaka, the circulation in both legs was severely compromised. The next step would have been surgical. He looked at me, Dr. Shigeaki Hinohara says, and asked why no one had told him what to watch for. That question changed everything, because the answer was, someone should have. So here is what Dr. Shigeaki Hinohara wishes more people knew, starting with a 30-second test you can do right now, in your chair, before this video ends. Sit forward slightly, both feet flat on the floor. Lift just your toes. Keep your heels down and hold them up. Count to 30. If that's easy, good. If by 15 seconds your calves are burning or the tops of your feet feel tight, that's information. If you couldn't reach 30 without your feet dropping or cramping, pay close attention to what comes next. What you just tested isn't flexibility. It's your calf pump. The mechanism your body uses to push blood back up from your feet toward your heart against gravity. The calf muscle, when it contracts, acts like a second heart for your lower body. When that pump is weak, or when circulation is already compromised, you feel it exactly the way you just felt it. A burn that arrives earlier than it should. A tension that has no good explanation. The American Heart Association estimates that peripheral artery disease, a condition where narrowed arteries reduce blood flow to the limbs, affects over 8.5 million Americans over the age of 40. That number is almost certainly an undercount, because most of them don't know they have it. The symptoms don't announce themselves, they whisper. And we've learned to be very good at not hearing whispers. The first thing most people notice, and the first thing most people dismiss, is a coldness in the feet that doesn't make sense given the temperature of the room. You put on socks, maybe double socks. The coldness stays. Not the kind of cold that comes from being outside, the kind that lives inside the foot itself, in the sole. Sometimes in just 1 foot more than the other. I always explain it to patients this way. Imagine a river with a dam upstream. Everything downstream still has water, but it's slower, quieter, less alive. That's what reduced arterial flow does to the foot. The tissue is still there, the nerve endings are still there, but the warmth that blood carries isn't arriving the way it should. This particular symptom has a timing pattern that matters. It tends to be worst at night, not during the day when you're moving, because movement activates the calf pump and temporarily improves flow. It waits until you're lying in bed, still, the house quiet, nothing to focus on. And suddenly, your feet feel like they belong to someone else, cold and faintly strange. And you pull the blanket tighter and tell yourself, it's nothing. Research published in the Journal of Vascular Surgery found that thermal asymmetry between feet, measurable difference in temperature between one foot and the other, is one of the earliest and most consistently overlooked indicators of unilateral circulatory compromise. You don't need a clinic to detect it. You need to notice it. Before we go further, is this familiar to you? The cold that doesn't respond to warmth? Drop a yes in the comments. I want to know how many of you have been living with this and calling it something else. Connected to that coldness, and this is where it gets more serious, is what Dr. Shigeaki Hinohara calls the morning window. Your first steps out of bed. Before your body has had a chance to warm up, before the calf pump has been activated by a full stride. In those first 30 to 60 seconds of movement, healthy circulation returns almost immediately. There's no drama. You stand, you walk, and your legs feel like your legs. But when circulation is impaired, that window feels different. There's a stiffness that takes longer than it should to resolve. A dull aching in the arch, sometimes the heel, sometimes climbing up into the calf. It feels like muscle soreness, which is why most people blame yesterday's activity or the mattress or getting older. The body makes this very easy to misattribute. Think of it like a garden hose that's been kinked overnight. When water first flows through, it's sluggish. It takes a moment for the kink to clear and for full flow to resume. A healthy vascular system clears that kink in seconds. When the vessels are stiffened by plaque or compressed by inflammation, that clearing process takes longer, sometimes much longer. The NIH's National Heart, Lung, and Blood Institute identifies this specific pattern, pain or stiffness that eases within minutes of activity, as one of the most reliable early signs of intermittent claudication, a condition that is treatable, reversible in many cases if caught early, but almost exclusively ignored in its early stage because it sounds too much like something normal. Now, this next one is the one I wish more people asked about. Most doctors don't bring it up until the patient has already moved into more advanced stages. And by then, the conversation changes. The skin on your lower legs and feet. Look at it right now if you can. Not for a wound or a rash. Look at the texture. Is it thinner than it was 5 years ago? Dry in a way that lotion doesn't seem to fix? Are there areas where the hair on your lower leg has stopped growing? Hair loss on the legs in the absence of shaving is not vanity, it's physiology. Hair follicles are among the first tissue to be deprived when blood flow is chronically insufficient. They're not essential for survival, so the body quietly stops feeding them. The result is a patchy, progressive thinning, usually starting at the ankle, moving up the shin, that has nothing to do with hormones or age. I always describe it to patients like this. When a town loses its water supply, the first things to go offline are the amenities, the fountains, the parks, the things that aren't strictly necessary. Hair follicles are the fountains of your legs. Their absence is the body telling you it's rationing. A 2019 study in the European Journal of Vascular and Endovascular Surgery found that skin and hair changes in the lower extremities were present in over 60% of patients with confirmed moderate to severe peripheral arterial disease, and that fewer than 1 in 5 of those patients had ever connected the changes to circulation. They thought it was aging, dry skin, normal. It isn't. Let that sit for a moment, because what it means is that the body has been leaving signs, visible, observable signs, and we've been looking at them and seeing something else entirely. Which brings us to what Dr. Shigeaki Hinohara calls the most dangerous misread: cramping. Specifically, cramping that arrives during activity and eases when you stop. You're walking, maybe up an incline, maybe just across a parking lot on a warm day. Somewhere in the calf or thigh, a cramping sensation builds. Not a sharp, sudden Charlie horse, but a slow, building tightness. You stop to rest. A minute later it eases. You walk again. It comes back. Most people call this being out of shape. Some of them are right. But for a significant portion, what they're describing is textbook claudication, the muscular pain of a tissue that is running out of oxygen mid-activity because the arteries supplying it can't meet demand. The muscle calls for more blood, the vessel can't deliver it. Pain is the result. Rest reduces demand, the pain eases. Movement increases demand again, the pain returns. Think of it like trying to run a factory on a generator that's too small. When demand is low, rest, sleep, sitting, the generator keeps up. The moment production increases, walking, climbing, exertion, the generator can't handle the load and everything slows. The factory isn't broken, the power supply is. The American College of Cardiology reports that walking-induced leg pain that resolves with rest has a specificity of over 75% for peripheral artery disease when combined with other risk factors. That is not a small number. That means if you are experiencing this pattern and you have diabetes, high blood pressure, or a history of smoking, even decades ago, this is a symptom that deserves a real conversation with a real doctor. Not next month. Soon. Now the 3 exercises. Dr. Shigeaki Hinohara has refined these over decades. He calls them his minimum viable intervention, the smallest set of movements that produce the most meaningful improvement in lower body circulation for people who can't or won't commit to a full exercise program. They take less than 10 minutes total. He has given them to patients in their 80s. He has seen them change outcomes. The first is the ankle pump. Lie on your back or sit in a chair with your legs elevated slightly on a pillow or footrest. Flex your feet, toes toward you. Hold for 3 seconds. Then point them away, toes extended. Hold for 3 seconds. Repeat 20 times. This activates the calf pump without any weight-bearing stress. It's what physical therapists use after surgery to prevent clotting. It works for the same reason here. The calf compresses the deep veins. Blood moves toward the heart. The second is what Dr. Shigeaki Hinohara calls the standing heel raise. Find a counter, a wall, something to hold. Rise onto the balls of your feet, slowly, over 2 seconds. Hold at the top for 1 second. Lower slowly over 3 seconds. 10 repetitions twice a day. The eccentric lowering, the slow descent, is where the real vascular work happens. A study in the Journal of Applied Physiology found that eccentric calf training improved blood flow velocity in the lower extremities significantly more than concentric-only training. The slowness matters. Do not rush it. The third is walking intervals. Not distance, not speed. Intervals. Walk for 2 minutes at a comfortable pace. If cramping begins, stop. Rest until it resolves. Not just fades, but resolves. Then walk again. Over weeks, the distance you can walk before cramping begins will increase. This is called supervised exercise therapy, and it is endorsed by both the American Heart Association and the European Society of Cardiology as a first-line treatment for claudication. Not a supplement to treatment, first line. It works. It is underused. 10 minutes, every day, starting tonight. Kenji, the patient. Dr. Shigeaki Hinohara mentioned at the very beginning, avoided surgery. It took 8 months. It took those 3 exercises daily. It took a medication adjustment and a dietary change and a lot of mornings where he didn't feel like doing any of it. But he avoided surgery. He walked his daughter down the aisle at her wedding 6 months after his worst appointment. He called Dr. Shigeaki Hinohara afterward, not to say thank you, though he did that too. He called to ask one question. Why hadn't he known to look for these signs sooner? And that question is the reason this video exists. Because the system doesn't always have time to teach you what to watch for. Appointments are short. The symptoms are quiet. And it is very easy and very human to wait until something is unmistakable before taking it seriously. You don't have to wait anymore. If any of what you heard today sounded familiar, the cold feet, the morning stiffness, the walking cramp that eases when you stop, don't sit with it alone. Get it evaluated. The conversation is simple. The test your doctor needs to start with is called an ankle brachial index. It takes less than 15 minutes, and it will tell you more than years of wondering. Start the heel raises tonight. Start the ankle pumps. The first step is never the dramatic one. It's the one you almost talked yourself out of. Tag someone who needs to see this. Not because it's interesting, because it might actually matter to them. You might be giving them something they didn't know they needed. And if this is you, if you've been dismissing these signs for months, maybe years, I want you to know something. You weren't being careless. You just didn't know what to look for. Now you do.